All right. So that's it. A little introduction to Surbi. She joined the Hunger Project India in 2018. She's the Senior Communications Officer. She's also a volunteer member at Make Every Woman Count, a London-based women-led organization on African women's rights. And prior to coming to the Hunger Project, she worked at the Women's Fund Asia. Is that correct?
Yes.
Great. Well, thank you for being here with us. And I'd love to give you a chance to introduce yourself and give us an intro to the overview of the Hunger Project in India.
Right. Good morning to most of you, and good evening to some who are in India or other parts of the world, in Europe or Africa. Thank you so much for having me, and I'm quite excited to, I guess, throw a little bit of light on the kind of work THP has been doing overall, but also in terms of its COVID response. I am the communications officer, as Sarah said, and I basically look at the content, the impact, how we're communicating that impact, social media management, and yeah, basically try to get the stories out from the ground and share with the world. Coming to THP India's overall work, so we, as you all know, we are all working on women's political empowerment in local governance. That's the larger theme. And our entire strategy is geared towards building elected women's leadership in village councils, strengthening their skills and capacities so that they are effective leaders in public office. Idea is also how they are leveraging that public office to address issues of democratic development, gender equality, access to education, social justice. How are they accessing legal remedies, and basically ensuring basic human rights for all, and especially with special focus on the most vulnerable and the marginalized. A sub-part of this strategy is that we're also, in 2015, we made a very critical intervention with regards to empowering adolescent girls. And this was carried out in, currently the program runs in 3 states, whereas the overall, the core program runs in 6 states. And with the adolescent girls strategy, the idea again was building the capacities of elected women in throwing light on the issues and concerns and challenges of the girls. And within that, we focused on the issue of child marriage, and how that affects girls' choices and, ability to make decisions about their life. And what we found in the process of this was there was this intergenerational dialogue that sort of took root, where both the groups, elected women and, because elected women had also kind of gone through that, that experience of having married very early when they were young girls. So with the joint capacities, they were accessing rights and entitlements, they were demanding accountability towards their rights, in the domain of health, education, again, skill building for girls so that they have ample choices, once they have completed their school. And if they're not, in some cases, they are not able to complete their school, at least they have access to some source of livelihood. And what it had also enabled in the adolescent girls program is that we had these active citizens emerging, active leaders emerging in the communities, again, because for them, they were seeing these elected women leaders as their role models. So the reason we are also empowering these elected women so that they can emerge as role models for others in the community. So that's pretty much the core of the program in THP. And with regards to elected women leaders, so one is building their capacities, but also building a conducive environment so that they're able to, they're able to make those informed decisions with regards to things, with regards to issues that need more attention. And for that, there are these federations, women's collectives, various platforms which can be used for collective action and for advocacy at different levels of the government. At the panchayat level, at the village council level, and at the block level, the district level, and even at the state level, depending on what the issue is and how much amplification that issue requires. And yeah, and they've been advocating, they've been engaging with the media. They've been leveraging their office to speak about girls' rights, about infrastructure building, about jobs, about healthcare, about education. And it's the entire program is built on this theory of change, that when you equip women leaders with the skills, with the knowledge, with the tools, they are in a position to really demand, not only their rights, but also work and fight for the rights of others. So that's the overall work that we do with regards to building women's leadership at the grassroots level.
That's all, just that.
Yeah.
Thank you so much. What is the current reach of our programs in THP India?
So we are based in 6 states with regards to the elected women representatives, the core program. We are working with 42 partners. So we have this partnership model. So we work through local community-based organizations who are then doing the training and capacity building for these elected women. And we're working in close to 2,000 village councils and engaging with currently 9,000, somewhere between 8,000 to 9,000 elected women leaders. And next year we will be completing 20 years of this work. So, but until now we have engaged with close to 1 million, close to 1 million elected women leaders in the village councils.
That's great. And you spoke a moment to the Girls Change tracks or some of the, specifically the adolescent girl empowerment programming. Excuse me. Do you have the reach for that particular program?
So, and there we are currently working with 3,000 adolescent girls in 3 states. And again, I mean, we're not covering all the, and even with the adolescent girls, the idea was that wherever our elected women leaders, wherever the THP work is going on with regards to elected women leaders, we mostly chosen the same panchayat so that it's easier to build those connections between adolescent girls and elected women representatives.
Yeah, and one thing I love about the Hunger Project model, and it's especially apparent in India, is that for each one of those 9,000 elected women leaders active at the moment, or 3,000 adolescent girls who've gone through some of the work with the Hunger Project, is that each one of those individuals is an amplification, can amplify their impact out into the world. So it's so much more, because then they're out in the world enacting change. And I think that's just such a great model.
Absolutely, absolutely. And we would see how that has the kind of work that we've been doing pre-COVID period, we would see how that helped us actually respond more effectively and better, in the current COVID period. So, there are those linkages, very, very strong linkages in how we were able to respond rapidly.
Yeah, great. And we'll get into that. So
yeah.
I wanted to show a quick video, if that's all right, from your colleague, Kanika.
Right. Absolutely.
And this is going to be a video about the migrant crisis. Is that correct?
Yes.
And do you want to give any background for anything that's not included in the video about that particular situation?
Pretty much all is included. Just to say that this is one of the issues that in the current COVID situation that elected women leaders in the council, in the panchayats have been addressing, which is basically there has been this vast sort of influx of migrant workers who are working in the cities back into the villages because of loss of jobs and loss of incomes. And they felt like they needed to be with their families, back at home. And it was how elected women leaders responded to that situation, how they supported the returning migrant workers. So this is what Kanika, my colleague, is speaking to, basically.
Great. Yeah. Thank you so much for that background. And this is to demonstrate, there are different methodologies to working with different groups of individuals, right? Because
Right.
we all have different needs. And
Right.
the wonderful part about the Hunger Project is this ability to sort of pivot and adapt to the needs of society and the community as the world changes. So, all right, I'm going to share a video for a little context on where this video came from. One of the core values of the Hunger Project, as I hope all of you as investors would know, or as just members of our family, is we're very committed to transparent and genuine connection. And we are very excited to be able to share anything that we have internally, making sure that we're sharing that externally. And this video actually comes from our staff meeting. It's our internal staff meeting that we had last week, I believe. So this is an update from a colleague to her colleagues, and we thought that it would be something very powerful for you all to hear. So if everyone could just make sure that they are muted, because otherwise we're going to get some funky feedback, and I will go ahead and share this.
As the COVID situation started unfolding in India in March this year, we realized very quickly that the millions of migrant workers that were returning from cities to their villages on foot, walking literally thousands of miles with little food and no money, were amongst the worst affected by this situation. And the villages where our elected women work were fast emerging as the site of this crisis. As an organization, we knew we had to respond, but reaching the elected women under this situation was a huge challenge since the entire country in India was under a curfew. But within a few days into the situation, we found that our team had started connecting with each other and with our partners to discuss ways on how we could continue working in this new situation that we found ourselves in. And soon enough, we were back in action. Each of the 42 partners of the Hunger Project in India got in touch with nearly 8,000 of the elected women we work with over phone and started providing them with the necessary information, guidance, and inputs about the many, many government orders and circulars that started coming out on a daily basis. We did phone calls, we developed text messages, voice messages, handouts, and not surprisingly, we soon saw that the elected women were leading the COVID battles in their villages. So what did the elected women do? Well, they did what they know best. They practiced expansive leadership. We saw the elected women springing into action to ensure that those returning home were treated with dignity, with empathy, that migrants were not getting stigmatized as disease carriers, that quarantine centers had basic standards of hygiene. Wherever possible, families were provided with food grains, were linked to employment opportunities, so that the most vulnerable households did not fall off the radar. And in all this, they never lost sight of the gender dimension of the crisis, always, always reaching out to women and girls who needed their support. In these times of extreme fear, of discrimination, of very scarce resources, the battle that the elected women are fighting is a tough one. But being a part of the Hunger Project program, it's a battle that they are prepared for and one that we do know they will win. Thank you.
Yeah, so thank you for that introduction, and it's really lovely to hear from Kanika as well. And as she was speaking to there, obviously the root of the way the Hunger Project is working right now in India has had to shift and change, and in light of the COVID-19 pandemic. So I would love to hear you speak to a bit of how some of those changes came about, some of the learnings that have happened, and who is particularly stepping into a space of leadership around it.
Right. Before I do that, I would just very quickly like to give a bit of a context in terms of what's happening in India right now. And so this lockdown was announced on March 24th, and it was one of the strictest lockdowns in the world. And over a period of 2 months, it was pretty much like a state of curfew where there was a state of forced inactivity. Businesses were shut down, still remain shut in many parts. There's been loss of jobs and incomes. And what we essentially had, what started as a health crisis, soon turned into a humanitarian crisis, giving way to a lot of social and economic distress. And so, for example, at the moment, we have 1 million plus cases of COVID in the country, and we were number 3 after US and Brazil. 14 million distress calls on children's health lines have been received so far. The domestic violence cases have really spiked. As Kanika also mentioned in the video, close to 120 million migrant workers have gone back to the villages. And basically, this just to give a sense of the dire state of affairs right now in the country. And also it brought to surface the kind of inequalities that exist in Indian society and the state and the way it functions. It was against this backdrop that we realized that it was a bit of a shock and surprise for everyone, as it was in the world, but I think we quickly shifted the focus to how to rapidly respond to the situation. And we realized that we are present in the village councils. We're working in close to more than 10,000 villages at the moment. We are visible, we are present, and we are active, we realize, and we just leverage that position to respond. And to the question of who are the real leaders, honestly, it has been, for us, elected women representatives have been literally the frontline workers, along with the health workers, along with the creche workers, along with the midwives and many other groups, and collectives. But for us, the primary aim was to make sure in the first phase, so it was basically 2-phase strategy. And in the first phase, the major aim was to make sure that the elected women had the right information, the accurate information, because awareness raising in the initial stages became very, very critical. And in that sense, we engaged with close to 8,000 elected women representatives via WhatsApp messages, calls. Women who didn't have smartphones, phone calls were made. Listening groups were created, and EWR, elected women, were equipped with the right and accurate information. And THP, which is in the back, the way we could support them was to, I think the first step was to create crucial messages. What is the kind of messaging that we're putting out? And we prepared 3 crucial messages. One was on what is COVID, the do's and the don'ts, maintaining physical distancing, washing hands, sanitizing, various government helplines that they can access in case of an infection or an emergency. This was followed by a second crucial message, which was around the myths and how to counter those myths. Because when this virus kind of came into visibility, we realized a lot of fake news was floating around as well about, for example, in India, it's too hot, it's going to get too hot, so the virus is going to die, or drink hot tea or hot water and you'll be fine, or things like if you there were also these kind of myths where they said that if you have a cough or a cold, this means you are necessarily infected, which may not be the case. So basically all kinds of facts to counter the myths. And the third messaging was around farmers and how because April and May were also the period of harvesting. So many of these farmers were going to go back into the fields. So the third messaging was around, again, things they need to keep in mind. Physical distancing. So the constant stress was on maintaining physical distancing, wearing masks, using sanitizers, how to wash their tools properly, and so on. And as a result, we reached out to more than 500,000 population across these 10,000 villages. Another part of elected women's response was, as frontline workers, to make sure that there are no leakages in the system, making sure that service delivery was happening as usual, because the government health was also announcing many, many orders and many, many schemes on almost a daily basis. So making sure that these schemes and these relief packages that were being announced were reaching, the people, especially those who are not very easily connected with the system. They were delivering midday meals to kids who used to go to school, but now because schools were shut, so how to make sure that those kids are not left hungry. They were making door-to-door visits, identifying who are the most vulnerable and linking them to various services. So this was the first step, in terms of how they were engaging. Soon after, we realized that as the situation unfolded, we realized that, and these were stories that were coming from our partners about, and these were really like heartbreaking stories about the level of starvation and the level of abandonment that they were witnessing in these villages. And we realized that it was a first for us. We've never done relief work, but I think it became very important for us to respond to this call and this cry for help. And so we immediately sort of got together and raised funds within India, reaching out to friends of THP in India, donors, and started planning on the relief work that we needed to carry out. Again, in this, a very crucial element has been our local partners, again, because without them, this relief work could not have been carried out, because they were the key link between the communities and, and us. And even in this, I think I would bring in the most fundamental principle of human dignity as to why we did it. And it is one of the core values of THP at large. What is the cost? How do we make sense? How do we make sure that the most vulnerable, those who have been disengaged with the statement, are not left behind? So human dignity, empathy, care, and protecting people's rights in time of such crises. And so we have to act fast, because the window of vulnerability was also expanding. So government, it's not that government was not doing, it was doing, but the implementation has been slow and uneven. So how do you fill the gaps, in that sense, with the increasing food insecurity? And just to give a few numbers here, we have so far reached close to 12,500 families in 3 states at the moment, Odisha, Bihar, and Madhya Pradesh, which are some of the worst affected states, and managed to distribute close to 4 million pounds of food. And so, yeah, this is the basic strategy, the 2 basic things, and the relief work is still going on. In Bihar, for example, the next round will start. And leading from here, speaking of the leaders, again, who are these leaders on the front line? So elected women representatives, again, they have a mandated role. They are to make sure that the villages are sanitized. They are monitoring relief schemes. But these are the roles that have been, it's part of their position as public office holders. But what is interesting for us, that how they went beyond this mandated role, how they were executing solutions innovatively and instinctively. So I think one of the first critical steps was, because the information was still filtering and trickling slowly, was to stitch masks. So, and a lot of them cannot afford the N95s or those expensive masks. So what they basically did, mobilized communities, mobilized other women, mobilized adolescent girls into stitching masks in bulk and distributing, in the villages. And you also have to keep in mind here at this point that the crisis has been very urban centered. It hadn't reached the villages yet. And it's only now slowly reaching as the migrant workers are going back to the villages. But so to make sure that they are avoiding any further spread, they started stitching masks. The second most interesting, I think, intervention that they made was with regards to violence, addressing violence against women and girls. They, created these networks of care, activated women's collectives, these as some elected women leaders. And, they were reaching out to women and girls who they knew could be potential victims. And they were counseling them as and when needed. So there was a lot of one-on-one that was happening, but at the same time, at the level of, at the administrative level, they were advocating for help desks, helplines to be installed. Making sure that there is increased patrolling, making sure that the police intervenes in time. And really, with even here, our adolescent girls, for example, in Rajasthan, they started these WhatsApp online support groups, so that, girls at this point, again, the violence against girls is, the chances of that are also very, very high, because as I said, child marriage, a lot, because of the loss of incomes and loss of jobs, child marriage, the chances of child marriage increasing are very high. And we have been hearing stories of how girls are really fighting back and, making sure that they do not get married, or because parents have no choice at the moment. They feel like if we do that, we get paid. So they're really like hanging by the thread, but at the same time, trying to manage the situation to the best of their capacities. And elected women are also keeping an eye on that.
Yeah, can I ask, I just wanted to ask just quickly. So as you mentioned, stepping into this space and the relief work and the immediacy of the work in response to a global crisis is
Right.
not inherently the work of the Hunger Project. So
Yeah.
Spoke a bit to the two-phase approach and then the strategic messaging within that as the sort of the first step. And then from there, the village leaders themselves, the community leaders themselves have really taken on strategies.
Right.
But that initial strategy, did that come from the Hunger Project office? Was that developed in partnership with local leaders? Kind of how did that phased approach start?
So elected women leaders are already mandated by the government, right? By the central government, that these are the 3-4 things with regards to monitoring schemes, sanitizing, making sure people are maintaining physical distancing. So that is part of their role. So they had started doing that, and they had started doing that instinctively. They were not waiting for our instructions. How THP supported them was making sure that they have access to right information. And that's where we started creating messages, because as I said, there was a lot of fake news and all kinds of myths floating around, not only in the rural areas, but also in the urban areas, So we wanted to make sure that from our end, what we thought best was to create these messages for them to share further. And so they were getting translated into different languages, right? Once these messages were prepared. Elected women were also, writing hand notes, hiding hand letters because they couldn't get things printed. So they were in Uttarakhand, one of the hill states that we work in the north. The presidents and the ward members were writing hand letters to put it up in different parts of the village, and again, saying the same things. So for us, it was pretty much in partnership with the partners, the local partners, in terms of providing as much support we can to the elected women on the front.
Great. And I just want to ask you one last question. Well, first and foremost, thank you for that. That was wonderful information. And it is so wonderful to hear that these leaders have taken so much of so much on and have been able to do so much as well as a collective. So that's really wonderful. Thank you. I want to close out with one last question, and then I want to open it up to questions. The first question we're going to have from our audience is going to be from Mary Ellen McNish. So Mary Ellen, you'll be up in just a moment. But Surbi, I know that your background, as I mentioned in the beginning, is that you don't only work in Indian development, you also have a background in African women's empowerment and development. So I would love to know kind of what are some of the correlations, the overlaps, the shared experiences that you see in just a couple of minutes,
Right.
what you see there in your work.
Okay. Do you want me to speak to that right now or later?
Yeah, if you could speak to that
Okay.
just very briefly, and then we'll open it up to audience questions.
That has been something that I've been doing for the last, since 2013 on and off. I've been part of this organization called Make Every Woman Count. And I work, mostly in research and again, social media, sort of managing content management there in capacity of trying to, again, earth stories from Africa about how women are sort of, participating in the political decision-making processes. And for me, what is interesting now that I'm working in India, primarily in the local governance setup, is to see that how the issues in both the contexts, Africa is a huge continent, India is a huge country, but the issues are very much the same in terms of the challenges women face in public spaces, in political spaces. The patriarchy is very much alive and poses a huge barrier in terms of how they can participate and how meaningful that participation is. And in terms of violence, both at the time of elections as well as post-elections, once they are in public office, we see that again it's happening, and it's only getting worse and worse, unfortunately. And because we're also seeing there is a backlash to women's rights across the globe. And we are seeing that, and once we see that and the kind of work that we're doing in India, it becomes only more fascinating and more urgent for us to amplify this demand for women in public office. It becomes imperative, absolutely imperative, that women are in these positions of decision making, because they are certainly doing something different. And we can see that even in the way the women-led countries right now, the way they are responding to COVID is absolutely inspiring. And so for me personally, just to see the juxtaposition of the two contexts, because they're both contexts that have experienced anti-colonial struggles against the empire, and they're still reeling in some ways from that impact, and miles to go to reach the parity that we want to see, really. But the kind of work that's happening in the parliaments there and at the governance, local governance level here in India, for example, it's absolutely inspiring.
Great. Thank you so much for that, Surbi. Thank you for all of that. All right. So Mary Ellen, I love the question you posed in the chat. I would love for you to be able to ask it.
Okay. I was just wondering, Surbi, if you could say a little more about the spike in domestic violence in India and
Right.
what the strategies THP are bringing forth to, I'm sure it's worldwide. I'm absolutely certain of that, but you mentioned it very early on, and I was just wondering, what are the strategies to kind of counter that?
Right. So,
thank you.
Yeah, okay. At the moment, the way we are seeing the cases, definitely the numbers are very high. State-wise numbers are still coming in, so we don't have those numbers at the moment. But what we know from our elected women and partners is that elected women in sort of partnership with the women's collectives and adolescent girls, they have created this space, they're creating these safe spaces. They're creating these whisper networks, where, because they are in the community and they are aware of the possible sort of locations where this violence is probably taking place, because suddenly there are no incomes, there are a lot of uncertainties, and so the violence is also rising. So they are the ones. No formal complaints have been made so far, from what we understand, but elected women have been able to resolve issues, as I said, on one-on-one basis. We do know from some cases where adolescent girls have been reporting as well, as they come to know of a certain case of violence, which again, so adolescent girls also go to the elected women first. So they have been, again, able to resolve those, within the community. And at this moment, it is more about making sure that women have access to safe spaces. And so they're activating the local networks, women's collectives, to able to address that. I hope that answers your question.
That was great. If anyone else has any questions, you can raise your hand, which is a little button on the bottom of your screen, and Anna can unmute you, or you can unmute and ask. Does it look like we have anyone, Anna? No? That is totally fine. Okay. Well, thank you everyone for being here. I especially want to say thank you to Surbi for bringing your expertise and your time. We've got a question. I see an Anna gesturing.
Yeah, Janet Ryden, why don't you unmute and go ahead and ask?
Yeah, hi. I've heard you mention working with local partners several times in terms of raising money for relief work, in terms of getting information to you that's important to know how to act. So I'm just wondering if you could say a little bit more about who those local partners are.
Right. So the way THP works is that for us to be able to be more effective on the ground, we work with close to 42 community-based organizations. So these are grassroots organizations that are based. And so we work with them in terms of mobilizing elected women leaders, in terms of training elected women leaders, in terms of, they are the first point of contact for elected women leaders at that level. And so these are basically the organizations that communities trust because they've been working in those communities for years, and these are basically like they literally provide this pillar to the work that we are doing, a very strong foundation to the work we are doing in the villages with elected women. So they are basically community-based organizations working on several issues, and they are essentially women's rights organizations because they have been working with women in the communities. And so yeah, they are a fundamental, very, very important element of the way we work. So there's a partnership model. We sign memorandums with them, and they are our partners. And through them, we reach out and mobilize women in the community in terms of, especially before the elections are fought, and after in form of training and capacity building. Does that help?
Thank you. Yeah.
It looks like Tatiana has a question.
Hi, yes, I do. I just want to say thank you for this wonderful presentation on the work that you're doing. It's very inspiring. I just wanted to know if you can talk a little bit more about the challenges and the stigmas on child marriage and what are currently being done. I know you mentioned most of it, but can you talk a little bit more about that as far as like elected women and what they're doing to prevent the child marriage?
Right. So child marriage has been one of the issues in the larger program that we work with adolescent girls. That's one of the issues that we are addressing because in India, what happens is, and I think while the number has come down, the average has come down a little, but India still remains one of the countries where this is a huge, huge practice and a very harmful practice in the way it affects women and girls, especially girls' ability to make choices or even imagine a future for that matter. And so what we do with regards to that, are you asking COVID specific or in general?
In general.
Okay. So in general, what we do is, so we have these capacity building trainings that we have with elected women, but we also have so while we have to train the elected women in terms of understanding that why this practice needs to be challenged, because a lot of our elected women have also gone through that when they were younger. So they understand how it hampers the health, it hampers the ability to make choices about future. it basically hampers them from becoming these whole people that we want them to become, or at least a right to become a whole person. And we also have these residential workshops that we have with adolescent girls on the side. These are called the Girls Leadership Workshops. And there again, idea is for girls to be able to, we empower them in the sense that they are able to raise these issues. They are able to understand that how this practice has been affecting their ability to step out, because we know the gender discrimination exists. We know patriarchy, is a huge, huge challenge, and how it differentiates between what women and girls can do and what boys and men can do. And so through these leadership workshops, girls also become aware about their rights, about how in the village council, who are the point of contacts that they can reach. And what we are trying to do is create this dialogue between the elected women and the adolescent girls, and like a joint collective force in terms of demanding that the government and the laws respect their rights, that they are able to demand accountability from the government in terms of accessing justice, because it is a matter of right. It is a matter of right in terms of there are many cases where girls are married at as young as age of 10. But we've realized that through the leadership workshops, there are many girls, for example, in Rajasthan, who've been able to challenge the minute they turn around 16 or 17 years old. They've been able to challenge that what happened was not right. They've managed to convince their parents. And so we work a lot, again, through the trainings. The partners are working very closely with families, and so the idea is to focus on their agency, their voice, and them emerging as active citizens in the process, because we've seen in this COVID period as well, how they are stepping, to the front lines, supporting elected women representatives, linking people, the most vulnerable, with the services, and really, really assuming this role of leadership. And it is only because they've been able to understand their own position, the power within, and the whole concept of power with, elected women and adolescent girls fighting together this harmful practice.
Thank you.
Thank you.
And thanks for the great question, Tatiana. Well, I think we'll go ahead and wrap it up. I want to be conscious of everybody's time who's taking the time to stay up late. Thank you to the entire THP India team. I really appreciate it. And those on the West Coast who maybe got up a little early. Just thank you so much. I can only speak for myself and say that there's a tendency to feel quite isolated right now, in many parts of the country and the world. People are actually locked in. And so this is an opportunity to feel much more expansive in the world, and there's much more a connection. So even just having an opportunity to talk to you, Surbi, has been great. And I want to end on, how are you? How are you doing?
I'm good. I'm very, very well. It's been difficult, but it's been a learning. It's been a huge learning, I think, in terms of personal growth, as well. I think I have a great team, great colleagues, in terms of, how we've been able to support each other. Unfortunately, I did succumb to COVID in 2 months ago, but again, thanks to, really my colleagues. They've been absolutely brilliant, in terms of giving me time to recuperate. But yeah, it's been learning. It's been a great learning for all of us. And I think we've all responded in different ways, but now we are sort of set in this routine and rhythm. It's a new rhythm. We're all in a very, very different realm, to be honest. And yeah, we're dealing with it and adapting to it as we move forward.
Well, I'm just so glad that you're well and being here. I know we all send you well wishes. we'll close out now. If you have any follow-up questions for Surbi, please feel free to email me. Anna, could you put my email address in the chat real quick? So reach out to me directly. I'm happy to connect you with Surbi and do any follow-up, or if you have any general questions, I know that we're all very happy to connect with you. Our next webinar is going to be in August. It's going to be similar to this in terms of a country overview and then looking specifically at the work that's being done to address the COVID-19 pandemic, and that will be for Bangladesh. So keep an eye out on your email for that. We will have some invites going out. And just, again, thank you. Thank you so much. I look forward to
Thank you so much for having me. Bye-bye.
Hi, everyone.
Thank you.
Bye.
Bye-bye.
Thank you, team. Bye.
Thank you, everyone. Thank
Oh,
you.
there's some-